Okay, we're going to go ahead and get started. Good afternoon and welcome back to another ICFRC program. Thank you for joining us for today's presentation by Valeria Adzo Adzatia, Edgar Munatsi, and Sandra Ejang. Sandra, I think, is not here yet, but hopefully we'll get here. I'm Dave Martin, IFC host today. I'm FRC board president. And as always, we thank our members, supporters, and interns for making these forums possible. I think we've had a little bit of trouble with a Zoom link that went out earlier, and Megan sent out a new one. Hopefully that'll help everybody. So I want to thank and acknowledge our organizational supporters, the University of Iowa's international programs, the University of Iowa's honors program, the University of Iowa Public Policy Center, and the Stanley UI Foundation Support Organization for their financial support. We also thank City Channel 4 and the UI Digital Libraries for helping us continue to make our programs available to online audiences. And we would also like to mention our gratitude to the Iowa Arts Council for their financial support through the Iowa Arts and Cultural Recovery Program. So as we get started, I'd like to remind everyone to please keep your audio and your video turned off for the duration of the presentation so you do not interrupt the speaker during their remarks. Following our panel discussion at around 12:45, we'll have a 15-minute Q&A. And you will be able to submit your questions via the chat function at the bottom of your screen, I think for most everybody. And at that time, we invite you to turn your video back on, but to keep your audio muted to avoid any background noise. So to give you a little background about the Mandela's Fellows, the U.S. State Department's Mandela Washington Fellowship started in 2014 as part of the Young African Leaders Initiative created by President Obama. This fellowship empowers young people from Sub-Saharan Africa through academic coursework, leadership training, and networking. And over the years, the Iowa delegations of fellows spend 6 weeks in Iowa, taking entrepreneurial classes and touring the state. And each year, ICFRC hosts a program featuring the Mandela Washington Fellows visiting the University of Iowa. And they're also hosted by the Civic Group here in Iowa City. This year, due to obviously to the COVID-19 pandemic, we're bringing you a virtual discussion from 3 former fellows. So now I'd like to introduce Dimy Doresca, who's the director of the International Business Institute at the University of Iowa Tippie College of Business. He will introduce each of the speakers and moderate today's panel discussion. So Dimy, over to you.
Thank you very much, Dave, and thank you, ICFRC, for giving me the opportunity to moderate this panel with 3 of the Mandela Washington Fellow alums of the University of Iowa. And I know with the power of Zoom, there's a lot we can do nowadays, and it is such a pleasure to be with ICFRC, you know, this today. And as Dave mentioned, you know, we always have this great event with ICFRC where we bring all the 25 University of Iowa fellows to the event, and they present. We do a panel discussions, and also they mingle, they network with ICFRC members. But we didn't have a chance to do that in 2020. But these panel discussions will kind of like provide us an update of what is going on the continent of Africa. That's why we have one person in West Africa, and one in East Africa, and one in Southern Africa that will give us what's going on the ground with respect to COVID-19, and also what are the opportunities? What's plan? What the plan they have, you know, to gain of the opportunities over there on the ground. So Megan, if you can remove the screen sharing so we can see and the pictures, and I'm going to ask the panelists to show their their video if they are able. So so I can have them introduce themselves and have them say a few things about them. So and I know Sandra, you are with us also, Sandra Ejang. I know you had some difficulty joining, but I know you are with us now. Welcome, Sandra. I'd like to start with Valeria Adzatia, who is in Ghana. Valeria, why don't you kind of like tell us where you're from and what have you been doing since you left the University of Iowa as a Mandela Washington Fellow?
Okay, thank you. And then good afternoon. At your end, it's evening in Ghana, and it's past 5 p.m. local time. My name is Valeria Adzo Adzatia. I'm a CEO of Gifted Hands Agro-Processing, where we process and add value to agriculture food crop products such as cassava and then cereals. Later, somewhere last year, I started my NGO, officially started my NGO to empower persons with disability. Currently, I'm running a project in that which has to do with the peer support for amputees. I must mention I am an amputee myself, and I realized the need for such a support group to help people who has lost their limbs to embrace life again and settle back into society and then have a quality life. So my NGO goes by name Smiles of Hope, and then we say that is where hope is found. So you'll get to hear more on that later on as we go ahead.
Very good, Valeria. Thank you for the introduction. And Edgar, you next. Tell us where you're from and where you are currently based and what you've been doing since you left Iowa.
Thank you so much, Dimy, and thank you, ICFRC, for organizing this opportunity for us to reconnect with Iowa. I must mention that I'm a proud Hawkeye ever since I've been in Iowa. It has been a lovely and wonderful opportunity for us to interact and mingle with people in Iowa. My name is Edgar Munatsi. I'm from Zimbabwe. I'm a medical doctor by profession. And I must mention that when I came for the Mandela Washington Fellowship in 2017, I was by that time leading an organization, an association of doctors in Zimbabwe that was representing all doctors that were working in public hospitals. I was mainly involved in dealing with issues of conditions of service for doctors, welfare, negotiation of their salaries. As many might know that Zimbabwe and many other African countries are facing a lot of brain drain with professionals leaving the country. So it was our responsibility as an association to negotiate for better conditions such that we retain the skills that are necessary for our population to get health. After that, after returning back to Zimbabwe from Iowa, I collaborated with colleagues and started an NGO, which is called Community for Health Equity in Zimbabwe, CHES. Basically, we were trying to bridge the gap, particularly for marginalized communities in terms of access to health, affordable healthcare, sexual and reproductive health. We have many people in rural communities who had no access to contraceptives, for example, difficulty in accessing antiretrovirals. Zimbabwe is one of the countries with the highest prevalence of HIV in Sub-Saharan Africa. So the institution or the NGO is still doing that work We have recently partnered with a US-based organization, Health Equity, in the US. Now we are tackling issues of dismantling the legacies of racism or colonialism in the health system. It's been a very eye-opening and a good experience in terms of dealing with some of the racial connotations that are still inherent in our systems. I would say then in 2019, towards the end of 2019, I was also fortunate enough to be awarded a British Chevening Scholarship to come and further my studies in the UK to do a Master's in Public Health for Development, which is where I'm currently now. I've, however, graduated from the program and looking to go back to Zimbabwe as soon as the travel restrictions are lifted and continue the work on the ground. Thank you.
Thank you very much, Edgar. And I was fortunate enough to meet with Edgar in London at the end of January of 2020, right before, you know, we got in the middle of the pandemic. So we had dinner at a restaurant, and we were all joking earlier before you all arrived, saying who knew that the world was going to shut down, you know, right after we got together. We had that dinner at the restaurants in London. So Edgar, you know, completed that program, and he's just waiting he's eager to go back to Zimbabwe and start working in the public health sector over there. Thank you so much, Edgar. It's such a pleasure to have you on the panel. Sandra, are you with us, Sandra? Please turn on your camera. Very good. Welcome, Sandra. It's such a pleasure to have you. Can you please introduce yourself? Tell us what you've been doing since you left Iowa and everything, where you are from and everything. Go ahead, Sandra.
Thank you, Dimy. Hi, Edgar. It's good to see you. My name is Sandra Ejang from Uganda. I am the CEO of Western Silk Road. We work with small holder farmers to sustainably develop an inclusive market in agriculture and trade through the beekeeping value chain. I'm from Uganda, and I mostly live in the rural area, that is the western part of Uganda. Before I came to Iowa, I was struggling in business. I didn't have a proper business plan. My business was barely off the ground. So ever since I left Iowa, I went from 5 farmer groups that I was working with, and now I have a network of over 1,000 farmers. I was very fortunate enough to be visited by Dimy in 2019, I think, May. I made him one of his favorite East African foods, chapati. He was very happy. I also, during the pandemic, I was able to start an NGO called Inuka Dada. Inuka Dada is Swahili, literally translated to raise a sister. A lot of people were struggling, especially some of the farmer groups that I was working with. They were struggling with finding market for their products because of the pandemic. And luckily enough for me, my sales actually tripled. Anyway, so Inuka Dada is a space where we get the smallholder farmers, especially the women, not necessarily in the beekeeping value chain, and we provide market access for them. Thank you.
Very good, Sandra. And as you said, man, I ate so much chapati when I visited you on your farm, and it was just an incredible. And I truly enjoyed my time over there and the work that you are doing. And you were having the training over there with, you know, over 25, I think there were over 30 beekeepers that you were training and help them, you know, find markets for their products. And that was incredible. And Sandra is right. She lives on the farm, and she lives there, and even the Google map on the GPS couldn't take us to her house. So so we got lost. Google map took us in the ditch in rural Uganda. So, but we had fun doing that. So I was with him, another Mandela Washington Fellows in Uganda. Yeah, well, he's from Kenya, but he was with me, Dave Okesh, and it was amazing to see all the land, the vast lands that exists in Uganda. So well, thank you again. Great panels. Well, I want to start with these questions. And Sandra, since you were the last speaker, I want to start with you. How has COVID-19 affected your activities? And tell us. I mean, I'm pretty sure that COVID-19 has affected your activities, but how has COVID-19 transformed you in your endeavors? Talk about how it affects your activities, and talk about how COVID-19 has transformed you in all your endeavors.
So this might come off wrong, but COVID-19 was a blessing to my business. During the worst time of the pandemic, my sales actually tripled. I went from, and Dimy, you were not able to visit our first shop location. I think, so the first shop location was in a kind of slum area. We've gone from maybe the equivalent of Chinatown to the equivalent of one of the highest ed places in Uganda. I'm very thankful for that. So I think a lot of people are developing a healthy lifestyle now. People are going off sugar, so honey is a very good alternative. And I think that is what has brought on the increment in my sales. And then on the negative side, a lot of my farmers who are depending on the beekeeping business as a side income went from the beekeeping business as a side income to a full income. So that put me in a position where I had to look for market for their excess products. And that is how my NGO was born. And that has also been a blessing in disguise, because now we have a shop that has sort of blended my original business idea before the beekeeping. I think, Dimy, you remember the vegetable delivery business? So I have the vegetable delivery business and the honey business in one place. It's sort of like a supermarket, but all for locally produced products.
This is wonderful to know. And let me put this into context for the audience here, Sandra. You know, in Africa, because of natural, you know, medicines, people have started taking a lots of herbals, natural medicines to take care of themselves during COVID. And honey products, anything that makes with honey, there is the propolis, there is the proponel, there is all of this, they have become really in demand on the continent. And I have fellows in Ghana who is in honey productions as well. I have you, and this is a major thing. I didn't even realize that that has helped you triple your activities, because people are looking for honey-based products to reinforce their immune system so they can fight the disease a lot better. That's great to hear, Sandra. Thank you for mentioning that, and I'm glad, you know, to hear a positive story outside of COVID-19, and I think that's great to hear that. So Valeria, I mean, on your side in Ghana, how has COVID-19 affected your activities, and how has the pandemic transformed you in a way? Tell us.
Well, so Dimy, on that, COVID-19 came in hitting me hard, especially small businesses in Ghana, unfortunately. Personally, also from where I was operating from, I was operating a model where we process in the rural area of Ghana and then we market in the big cities. When COVID-19 hit Ghana, the major cities were closed down. So you couldn't enter or come out. So it affected marketing of our products, sending our products to the big cities to market. Although our lockdown wasn't that long a period, but it took a toll on things returning back to normalcy. And also because our most markets were being shut because market women were not adhering to protocols and the public gatherings and everything. And looking at our market systems are quite crowded and stuff like that. So government has to clamp down on that to curb on the spread of the COVID. So it's
Looks like
big toll that led to 31st, the fragility of our
go ahead, no, go ahead, Valeria.
Of our
we were having
capital.
issues hearing you, but you will
Okay.
fine now. Go ahead.
Okay, good. So the capital for small business holders like myself, it's mostly small. Some can't even go beyond a week with the capital they have in hand. So it was a big challenge to us as small business owners down here. Although the food business doesn't seem to be affected so much, but the major issue was with the distribution and how to get the food out there. And because these middlemen don't come to the rural areas to buy the raw foodstuffs, because we don't process a lot and add value to our food crops here in most parts of Africa. So it brought a lot of difficulty to the rural farmer. Just a few were able to come down and buy, and that's increased prices out there. And because the crops were ready and there was no buying, there was no market for it, it led to a lot of losses for farmers who lost their crops during that time of the COVID lockdown and stuff like that. And it took long for people to get back into normal lives again after the lockdowns and everything. And what affected us more was also because hotels, eateries, restaurants were closed because of the large numbers, the restriction on the large numbers, and then all of that. And they take a majority part of the raw food crops that we produce down here. So that was a bit of challenge for us. However, beyond that, we saw prospects in that a lot of e-commerce businesses started opening up. We got to market our products online, and then customers get to order and then delivery is done. So you see that there is an increase in these two business service provider, which is the e-commerce and then the delivery. Customers were now comfortable buying from the comfort of their homes and offices. And it's still a trend in Ghana going forward. And personally, for me, the COVID thing, being at home, gave me a time to really think through, and then went in full time for my NGO thing. I had two crises, a personal family crisis that I had to deal with. That had me to even relocate altogether from where I was staying, coupled with the COVID thing. So I rather focus a lot of energy into creating my NGO and officially got it registered and getting it running. And then December, we started our first project, which is the amputee peer support thing that we are doing. And it's been running smoothly to date. So far, we have reached over 50 beneficiaries so far, with good testimonies to tell on that. So yeah, COVID came, it hit us hard, but we saw opportunities in that to do other things and passions and things that we didn't have the time to do all these years. We had that pause to do that and had the family time more. Yeah.
That's good, Valeria. I'm so glad to hear that COVID-19 really pushed you to pursue your social entrepreneurship endeavor, which is really working with amputees, you know, helping them understand their importance in the society, and also, you know, your business was transformed by using online platforms to do distributions of your products, which is great. And thank you again. And Edgar, I want to come to you though. I know, you know, you are not in Zimbabwe right now, but your activities continue and you are still being involved. When I met with you back in London in January, you were still being involved in a lot of things that's happening right there, down there in Zimbabwe. So how have you seen those activities affected by COVID? And you started telling us a little bit about the transformation, but I want you to tell us more. So how have your activities been affected in Zimbabwe, and what transformation that you've seen?
Thank you so much, Dimy, for that question. I must say that being in the medical field, being a medical professional myself, COVID-19 has brought to the fore or exposed a lot of the existing health inequalities in terms of access to healthcare. We have seen, we knew for a long time that our health systems were not coping, but that was made bare by COVID-19. We had seen our own practices, our surgeries, our rooms. Things are overwhelming. Patients are not affording the treatment that is required, unfortunately, for COVID-19, because of a population that has a large number of people with chronic diseases. We had, even though our numbers are very minimal if you compare to global figures, but unfortunately we had a large number of people getting severe disease from COVID-19 and requiring intensive treatment, which basically was not there. And then what then did, we saw the emergence of people requesting treatment in their own homes, because in any case, the hospitals with the few ICU beds were full. So people had to improvise and make sure that they get whatever treatment they could get in the comfort of their homes. We've seen many colleagues coming up with ideas to try and, because of the shortage of oxygen, not only in Zimbabwe, but many countries, people came up with ideas of how to humidify just the water that we use in our homes to make sure that we deliver the oxygen to patients who are suffering, even though it may not be adequate and might result in long-term problems. But that was an invention that had to be done given the situation that was on the ground. Another transformation that I've seen on the ground is that the reliance on technology and internet to come up with platforms where patients can request for services in their homes using mobile apps or just internet in general. However, this was very difficult given that the majority of people are living in the rural areas and with limited access to internet, or if they have access, there's very low bandwidth, so which brings a lot of challenges. At a personal level, COVID-19 has given me an opportunity to reflect. If we have learned anything during this pandemic, is that the health, our own health, we don't have to just care about ourselves, but we care about our sisters, our brothers, our neighbors. This has been the big lesson in terms of COVID-19 pandemic. We've seen the easiness with which the disease can spread, how the effect it has in a different community can easily ripple and affect other communities. So when I reflect upon that, I remember when I met Dimy in London, I was trying to explain to him that the way I sometimes wired or I view things is that in as much as we ought to come up with business ideas that transform our communities and societies, we also ought to come up with leaders in society who take initiative, particularly in terms of putting pressure on the people who are in public office to deliver social services, healthcare. And this is quite a big passion of mine in terms of making sure that the government is held accountable in terms of delivering services to the people. And this is has been, I think I would say, that passion has been emboldened. I see the reason now why it is very important that we do that, we continue to do that. I see the reason why many different communities or many countries ought to be concerned about the situation in Africa. If Zimbabwe or Ghana or Uganda is suffering, honestly, it won't only end there, as we have seen with COVID-19. It can easily affect the US, it can easily affect many countries. So that has been a huge lesson on my part.
Yeah, that's good. That's good, Edgar. What an interesting time for you to be in public health, because and we see this pandemic, COVID-19, but we know that COVID-19 is here to stay. There will be different variants of it. And I'm pretty sure you probably can't wait to go back to Zimbabwe to start, doing further research on the different variations of COVID-19 and how you can bring your expertise, your new acquired expertise into this field, to collaborate with your colleagues in the healthcare sector in Zimbabwe. So thank you again and for your perspective on this and to explain to us how you see this. Now I want to check with you, Sandra. I'm going to come back to you, Sandra. Now you said you have taken advantage already of opportunities offered to you by COVID, with a lot of people jumping, getting into natural ways of boosting their immune system, and honey is one of the ways. But now, how are you positioning yourself though to take advantage of other opportunities? I know you have the food delivery, the food baskets business, and you also have honey, and you also have your social venture, empowering young girls in Uganda. So how are you positioning yourself into all of that?
Dimy, thank you very much. I'm working very closely with the University of Iowa and taking advantage of every opportunity that they avail to us. Thank you, Dimy. So the way that I'm positioning myself is we are trying to create the whole value chain in beekeeping. That includes starting a body care line that is honey-based. So we are really focusing on that right now. And the university is helping us to figure out a few things here and there, a marketing strategy, who to sell to, things like that. This has been advantageous in that we have a lot of raw material in Uganda. Part of the raw materials are sesame seeds. We have sunflower. We have the shea nut trees. So we have a lot of these at our disposal, and there are not enough people doing the processing. So we acquired a cold press machine, and now we are able to produce raw products.
That's
Because of our ability to produce. Yes, so because of our ability to produce all these raw materials, we are actually able to produce a very fairly priced cosmetics line that is honey-based, all natural, and that is what everybody is going for. So we are really, really setting ourselves up for success.
This is wonderful, Sandra, and that was good timing for you as well, when the student that participated in the International Business Consulting Team competition, and we won the competition because they could partner with you to show that we can use the honey base, the honey as a base to do cosmetic products, and I'm so glad that this is being pursued, and congratulations, and it is a true partnership. It is a win-win situation. We have to thank you as well for providing such great opportunities to University of Iowa students, and that's a frank collaboration, and I'm very grateful. Okay, Sandra, thank you. And Edgar, what you know, and I know in the healthcare field, there are a lot of things that you can do, okay? So what are the lessons learned that you are going to capitalize on when you get back to Zimbabwe to make sure that people understand more the public health challenge that the continent of Africa is going to face, you know, post-COVID? And how, as a public health expert, how do you think that the country could take advantage of that opportunity? The country and the continent, for that matter, could take advantage of that opportunity to prepare itself for the next pandemic. What do you think?
Thank you, Dimy. I think because now we are living in a globalized world, it's basically a village. It is clear that we are going to have another pandemic in the near future. It might be 5 years, might be 10 years. And like you rightly put it, it is important that countries, particularly in the African region, prepare for such kind of things. And one of the things that I've realized that has been lacking really is coming up with a regionalized or a block kind of approach in terms of dealing with the pandemic. For instance, right now, we have seen countries trying to go it alone, which is basically not working, particularly in the procurement of COVID-19 vaccines. We have seen countries are struggling to get even vaccines that are enough to cover only 2% of the population, or even the frontline workers. Mm-hmm. It's a huge problem, but basically because many of our countries are going it alone. We have seen the efforts that were done by the European countries as a bloc, negotiating as a bloc with manufacturing companies to make sure that they secure COVID-19 vaccines. And they have, some of the countries have managed to secure more than enough of what they need, some 2 or 3 times more than their population. But this is because they are doing things in a concerted way. So I believe that this is an opportunity for Africa to come up with such kind of arrangements. And secondly, in terms of building capacity, surely we cannot continue with the current situation where we rely and depend on Western countries for things like vaccines. We have the expertise, but however, there seems to be lack of political will in terms of investing in the infrastructure. So I believe that countries need to come together. For instance, negotiate with manufacturing companies, big pharmaceutical companies. Honestly, we ought to be having 2 or 3 companies right now on the continent producing vaccines to make sure that we meet the demand that is there. Unfortunately, with the way things are right now, we might see some African countries not getting vaccines until maybe 2023, which is unfortunate. Where if we are negotiating as a bloc, probably we will be successful in terms of dealing with those issues. And generally, also another issue that we also need to embrace is going back to the issue of technology, making sure that the infrastructure is there. We've seen South Africa in the Southern African region seems to have a good capacity in terms of these things, but it needs assistance so that we do not burden South Africa only in terms of taking care of their brothers or their neighbors. So it is important, in my view, Jimmy, that this COVID-19 pandemic works as a wake-up call to many leaders to say we need to work together. We need to fight in the same corner, not just to spread our army very thin and not achieve anything.
No, that's exactly right. Put our ego on the side and work together, because it's not acceptable that some countries in Africa will not receive the COVID vaccines until 2023. It's not acceptable. And as you said, we know that there is the capacity on the continent to make the vaccine there for the continent. So it is time that Africa starts to think of ways to rely on itself and self-reliance, really and truly. I mean, you're talking about 54 countries, 1.5 billion people. There must be a way for Africa to work together and get some concrete solutions. So I know, you can start sending your questions now while I'm getting Valeria on these questions. The audience, please start typing your questions, and I will read them to the panel. So Valeria, again, how are you positioning yourself to take advantage of the opportunities that comes to you post-pandemic?
Okay, so thank you, Dimy. Post-COVID pandemic, I am looking at doing a lot in terms of value addition, as is a core mandate of Gifted Hands Agro-Processing, because the COVID-19 has taught us hard lessons, the hard way, especially for the rural farmer, that value addition is the way to go. It's about time we add value to whatever we produce and package well, and then present to be able to preserve it for a longer period on the shelf than just doing the traditional way of growing the crops and selling it fresh. Should we go into another pandemic such as this, we'll be seriously hit if we don't learn our lessons now and here. So that brings me back to government as well. We're expecting that governments in developing countries such as ours should do more in providing a COVID relief fund to small businesses, because we have really been hardly hit by this COVID. If we are not careful, a lot of small businesses may not be able to come out of this crisis going forward. We have some already relief funds ongoing in Ghana currently, which is the coronavirus alleviation program. However, the concerns that we have as business owners in Ghana is the number of people that have access to this funding. Just this morning, I was listening to an economic forum discussion by one of our TV stations. And then over there, they mentioned that 20% of hotelier associations that applied for this fund, only 20% of them had the funding. Out of that 20%, it is only 10%. They gave them only 10% of what they actually asked for. So should I ask for like $1,000 and you end up giving me $100, it's like a no-go area. Already it's like my hands are behind me and I won't be able to use it for anything. And this is funding that has to be paid back. So in the long run, before you realize, most businesses are not able to use the funding because it's just little and then not sufficient. And going forward, I would suggest that our government should consider sector-based solutions for this COVID crisis going forward. Let the solutions be sector targeted. It could even cut across gender because most businesses in Ghana are owned by women. And then Ghana has a lot of women owning businesses across the world. As it stands now, over a period of years now, Ghana has been leading that. So, and you know, the businesses owned by women have challenges with accessing capital already before this crisis came in. So we need sector-based approaches to addressing these challenges. It could be grants, it could be loans with low interest for such businesses going forward. And then the money should be sufficient to help them get back, whilst also tracking what the money is being used for. And then also for the agriculture sector, again, especially that is where I am in, the inputs for agriculture. You see, last year, what hit us most was the fact that our farming system are rain-fed in this part of the world. In Ghana, for instance, our farming season starts in March. Then we had our first COVID case in March. Then weeks later on, we had the lockdown. And so inputs could not move across the country smoothly, and that affected outputs in the agriculture sector for that. And so going forward, we are expecting a lot of investment in those areas. We could go irrigation to have all year round farming so that we don't have this crisis as it goes along. In as much as our governments want to help in this crisis, there was a time during the lockdown, they were feeding people with hot meals. It's rather appreciated from an economic view that it should rather be money, cash giving assistance rather. In that way, the cash gets to circulate within the country. So instead of having products like the canned food, which are already imported and competing with the locally produced food industry that we already have, with the cash, the person may decide to buy the fresh vegetable or crops himself and get it prepared than having canned tomato or canned fish given to him or her or already prepared food in that line. In that way, the cash is locked up and then it affects all of us going forward. Then again, back to my NGO, I think post COVID going forward, I'm already putting a lot in that and I look forward to that a lot. Just last month, I graduated from a counseling class to equip myself more to understand the needs of these people, especially with their emotional and then psychological aspect of the needs, because that has been found to be the major needs of amputees, how they would handle those things. And I intend to put a lot into that going forward, and then seeing Smiles of Hope put more smiles on faces of amputees. Yeah.
Very good, very good. And that's a lot. And you say a lot of things here about the role that women play in entrepreneurship in Ghana, and how you kind of like play a central role in there as well. And I really appreciate that, Valeria. You are a true entrepreneur, and there's a lot for you in that sphere in Ghana. Thank you again. And there's a question here, Edgar, I probably would like for you to address. How is the the vaccine distribution going in Africa, and what countries that you would say is ahead of the game, and what countries you think would be affected by getting the vaccine too late?
Thank you so much, Dimy. I think there are many issues that are affecting the distribution of vaccines in Africa. To start with, there's an issue of vaccines that require ultra-cold, environments, like the Pfizer vaccines and the Moderna vaccines. Those that has to be refrigerated at -80 or -70 degrees Celsius. Unfortunately, because of those requirements, many countries in Africa find themselves unable to do that. Basically, in terms of acquiring Moderna and Pfizer, many will not be able to do that because of the requirements. I think in Sub-Saharan Africa, I know that Rwanda, South Africa, and Namibia and Botswana are the countries that have indicated that they have the capacity to acquire some doses from Pfizer and Moderna when they come available. For the rest, we have seen many countries receiving some donations from China in the form of the Sinovac and the Sinopharm vaccine, which China is producing. But I think the more realistic option in terms of many African countries is the COVAX facility that has been led by WHO and other partners like the Global Alliance for Vaccine, the Gavi, with the US and the UK being the major donors in that pool. In the COVAX facility, there are countries in Africa that have joined as wishing or wanting to receive donations. And then there are countries that have joined as self-financing partners, however, using the facility as a bargaining power in terms of negotiating to get some allocations. Again, countries with capacity like South Africa and Namibia and Botswana have joined as self-financing partners. And then the rest are waiting to get donations through the COVAX vaccine. They have done quite a good work so far. We've seen Rwanda, I would say, is leading the pack because of one, the fact that I've mentioned that they are able to use the Pfizer vaccine. They've received the Pfizer vaccine through the COVAX facility. And I think during the early phases of the COVAX facility, they mainly had the Pfizer and the AstraZeneca. Unfortunately for Southern Africa, because the AstraZeneca vaccine was then seen to have reduced efficacy against the South African variant of coronavirus. So that also is a huge blow to Southern African countries. We know South Africa had acquired about 1 million doses of the AstraZeneca vaccine, but they had to donate it to CDC Africa so that they can find another country that can use those vaccines because of the resistance to the South African variant. The South African variant is, however, the most now the most prevalent in many Southern African countries, Zimbabwe included. I think to the tune of more than 90% of the variant that is circulating in Zimbabwe is from South Africa. So that's a huge blow. However, there are countries like Tanzania in the Eastern African region that have taken a denialist approach. Unfortunately, now the former president, President Magufuli, died, but we have seen that they've not changed they've not shifted from that stance where they are denying that COVID-19 is a big issue. So there are no restrictions in Tanzania. And I would imagine that Tanzania, unless they change their approach, they are going to be one of the last countries to get the vaccines. And then we have some unfortunate cases in Africa, Zimbabwe included, where they've received vaccines from China. The Chinese vaccines, there are concerns there, however, they might be exaggerated because of the geopolitics, but there are genuine concerns in terms of the clinical trials, because I think the Chinese vaccine was started to be rolled out while it was in the third trial, clinical trial phase. So, but those are some of the issues. Zimbabwe has received those doses, but unfortunately, there's massive vaccine hesitance, not only in Zimbabwe, but many other countries. We have seen religious leaders coming, disencouraging their followers to say this is an antichrist. So for instance, Zimbabwe started the program on the 18th of February. And I think up to yesterday, they only vaccinated about 70,000 people, which is unacceptable. And they've close to 1.5 million doses that they've acquired. And these vaccines are going to expire before, if the rate at which they are vaccinating people continues the same, it means we are going to lose all these vaccines, yet they are very difficult to come by. So these are some of the dynamics that are happening on the continent in terms of a huge vaccine hesitancy, misinformation spreading, like wildfire, people disencouraging people to get the vaccine. So I believe that many countries will need to come up with very innovative ways, and also maybe there's also a kind of mistrust in terms of people trusting their governments because of the way things have been happening in the past, the politics. So I would imagine that involving people from the communities, be it traditional leaders, religious leaders, and other people that are influential in society, to be on the forefront of encouraging and messaging, encouraging people to go for vaccines would hugely improve the numbers that we are seeing right now. So those are some of the challenges that we're seeing, Dimy. We are not getting enough vaccines on the continent, that's for sure, particularly to cover the frontline workers, because they have been hit very hard. We have lost a lot of our colleagues to the pandemic. We are hoping that by the end of the year, if all goes well, most health workers would have been vaccinated by then through the COVAX facility, because they are going to try and give people at least doses that are able to cover 2% of their populations, which is maybe enough in some countries to cover health workers, but there's a huge deficit.
Thank you so much, Edgar. We're probably going to have you back yourself to do an entire show about the vaccine situation in Africa. This is very interesting. So Megan, Dave, take notes. This is an important issue. We have to discuss that and make a lot of noise about this here in the United States, because we need to help Africa get more vaccines. Yeah. Dave, thank you, panelists. This is great. We always run out of time when we're having great speakers, don't we? Always. So this is wonderful, Edgar and Sandra and Valeria. Thank you so much for your time. Thank you for giving us this insight about what's going on the continent of Africa. Dave, you have the final word, Dave.
Okay, all right, thanks. Thank you all very much. Just a couple of words here before we conclude. I want to make sure everybody knows we are very grateful to be able to make our online programs free and open to the public, but we do rely on the support of our members and attendees in order to operate. So we would deeply appreciate a free will donation to help us cover operating expenses, particularly during this period of online only programming. So we're going to conclude our program now. I want to thank Valeria, Edgar, Sandra for your presentation. It's wonderful to be able to see you all in different parts of the world, which we can do on Zoom. And so one of the things I wanted to do to end up with was to make sure we're going to present you with our coveted mug, ICFRC mug, that we present to all of our presenters. And we're going to have to arrange with Dimy to get it to you, okay?
Definitely. So
we'll do that when we're done here. Thank you very much, everybody. We are adjourned.
Thank you all. We'll be in touch. Thanks. Bye-bye.